COVID-19 lockdowns made many of us feel isolated. Skilled nursing and assisted living facilities experienced this to another degree. With constantly changing guidelines, how are the staff and residents of these facilities doing today? Let's take a look. While the COVID-19 lockdowns in spring and summer of 2020 hit all of us hard, perhaps those most affected were the residents and staff of skilled nursing facilities. For them, physical, mental, and emotional challenges were especially intense.
Everybody dealt with the shutdown last March and April, but skilled nursing facility patients and its employees too really had a much longer impact of that.
The pandemic has affected everybody in the building, residents and staff, all residents. The biggest way it affected our residents is their lack of family visits, their feeling disconnected from their families, more of a sense of loneliness. The good part of that is a lot of the residents look at our staff like their family.
Took it like a war type mentality of, we got to go to battle and we got to make sure we're protecting our most vulnerable. I mean, none of our residents went to the store for over a year.
One of the main challenges these homes and facilities met was a rapid drop in staffing numbers. Difficulty retaining staff has left many nursing homes, skilled nursing, and assisted living facilities unable to accept new patients.
When COVID hit, staff retention was very difficult. We lost about 30% of our staff in a week. It was rough. We were scrambling for nursing staff.
One of the biggest things that we work on or try to work on is staff retention and boosting morale. Everybody feels a sense of burnout in one way or another. The increased workload, the work demands, and COVID burnout. We do a lot of employee recognition here.
I think a lot of people left the industry because they were scared and thought that was a dangerous place to be, as opposed to what it actually is, which is probably the safest place to be.
Now, with many aspects of daily life returning to normal, the status of our area's residences is also changing.
Of course, all the healthcare personnel still have to remain masked, and we encourage the community to do the same. I understand it's a hot topic item. Of course, we still protect the most vulnerable population for this disease.
We can also have communal dining, some activities, so things like that have changed. But as far as the regulations and that, we still have some pretty strict guidelines that we have to follow. That haven't changed since the pandemic started.
Our residents are having a lot of fun on activities, they're congregating, they're smiling, they're able to sit with each other at dining room tables, they're able to play kickball and exercise together.
Maybe the most exciting change is the ability for residents to have visitors again after a long year without.
So at the height of the pandemic, we were not allowed visitation at all. We did have some end of life, compassionate care, to now where our visitation is scheduled. It's 2 visitors at a time. It doesn't matter if there's a change. Encourage 30-minute time limits, strict infection control practices that have to occur.
Our visitation policy is simple. If you're vaccinated, just call, make an appointment, we will get you in. If you're unvaccinated, we recommend you test. If you're unvaccinated and you refuse a test, we do have a responsibility to put a little bit more restriction on the visitation. So we did our job and we got all of our residents vaccinated, again, 97% of them. And now we hope that the community will do the same to make sure we can put this pandemic behind us.
For ABC 10 CW5 News, I'm Marta Berglund. Thanks for watching ABC 10 News on YouTube. To get the latest Upper Peninsula news, sports, and weather, make sure to subscribe to our channel and like us on Facebook.